Hello, everyone. My name is Greg Brumley, and I am honored to present this discussion on the comparison between non-opioid and opioid treatments for chronic lower back pain. Managing chronic pain is a pressing issue in healthcare, as it affects millions of individuals worldwide and significantly impacts quality of life. As healthcare providers, it is imperative that we explore evidence-based treatment strategies not only alleviate pain but also enhance patient well-being while mitigating potential risks. This presentation will dive into the effectiveness of non-opioid interventions compared to opioid therapies, emphasizing the need for safer, sustainable, and patient-centered approaches to pain management. The guiding PICO question for this research is, how do non-opioid treatments compare to opioid medications in managing pain in adult patients with chronic lower back pain over a 6-month period? While opioids have traditionally been used for pain management, their long-term use is associated with significant risks, including dependency, addiction, and overdose. Non-opioid treatments, such as cognitive behavioral therapy, acupuncture, and exercise-based interventions, along with non-opioid medications, offer promising alternatives. These methods not only reduce pain, but also improve overall function and quality of life by addressing both physical and psychological aspects of chronic pain. The goal of this research is to compare these approaches and determine their effectiveness relative to opioid therapies. Major findings from research. Kumar and others' study showed that cognitive behavioral therapy and meditation significantly reduced pain and disability compared to physical therapy alone. These approaches address the physiological aspects of chronic pain, improving coping mechanisms, and reducing dependence on medication. Wang and others show that acupuncture has been shown to enhance neuromuscular function and provide effective pain relief by stimulating key pressure points. While flash cupping did not significantly reduce pain, it may help with muscle relaxation, mobility, and overall quality of life. Totally and others show that Pilates offers short-term pain relief benefits over home-based exercise programs. However, these benefits tend to diminish after 6 months, emphasizing the need for long-term adherence to exercise-based interventions for sustained pain management. Bushy and others' studies showed how optimized opioid therapy showed a slight advantage over CBT in pain reduction at the 12-month mark. The difference was not clinically significant. This highlights CBT was a viable non-pharmacological alternative for chronic pain management in veterans. Sandhu and others showed a structured opioid tapering program incorporating education and peer support significantly reduced opioid use. However, tapering alone was not sufficient for effective pain management, reinforcing the need for a multi-modal approach that integrates non-opioid therapies. Despite the promising findings, there are several notable gaps in the current research. Lack of long-term data. Most studies focus on short-term outcomes, 6 to 12 months, leaving uncertainty about the sustainability of non-opioid treatments benefits over multiple years. Further research is required to assess long-term efficacy and patient adherence to these treatments. Limited sample sizes. Some studies had relatively small participant groups, reducing the generalizability of findings. Larger trials with diverse participant demographics are needed to validate these research and ensure broader application. Population-specific research. Many studies were conducted on specific populations, such as veterans or patients in rehabilitation programs, making it difficult to apply findings in general populations. More research is needed to determine whether these interventions work equally well across different patient demographics and socioeconomic backgrounds. Multi-modal treatment comparisons. Few studies have directly compared various non-opioid treatments head-to-head to determine which approaches work best for specific patient groups. Future research should aim to evaluate the combined effectiveness of multiple non-opioid interventions to develop optimized treatment protocols. To advance the understanding and implementation of non-opioid treatments for chronic lower back pain, future research should focus on extending follow-up periods beyond 6 months to assess long-term efficacy and potential relapse rates. Larger multi-center clinical trials to increase the reliability and generalizability of findings. These trials should include diverse populations to ensure the effectiveness of non-opioid treatments across different demographics. Examining combined treatment approaches, such as integrating physical therapy with CBT or acupuncture to determine synergistic effects. Studying multi-modal interventions may yield the most effective and substantial pain management strategies. Developing standardized guidelines for integrating non-opioid treatments into clinical practice to provide clear protocols for healthcare providers. Establishing best practice based on robust clinical evidence can facilitate widespread adoption and improve patient outcomes. In conclusion, non-opioid treatments such as CBT, meditation, acupuncture, and structured exercise programs present viable alternatives to opioids for managing chronic lower back pain. These interventions not only address pain relief, but also contribute to long-term functional improvements, reducing the risk of opioid dependence and associated adverse effects. While opioids may still have a role in pain management, the risk associated with long-term use necessitate exploring safer, more substantial strategies. Healthcare providers should consider a multidisciplinary approach that incorporates these non-opioid treatments to offer holistic and effective pain management solutions. Future research should focus on refining these approaches, ensuring their accessibility, and expanding knowledge on their long-term efficacy. With ongoing advancements in evidence-based practice, we can continue to improve treatment outcomes for individuals suffering from chronic lower back pain. Thank you for your time. I welcome any questions and look forward to discussing these findings further.